Hi friends, good evening. Once again welcome back to my channel Mookambika Nursing. Friends, we are preparing questions for ESIC exam. ESIC exam is on 7th July. Here I am preparing subject wise questions. 2-3 friends asked me to prepare subject wise questions. That's why I am preparing subject wise questions. Today we can see questions from Fundamentals of Nursing. First question, which of the following was the first widely used antiseptic and disinfectant? Options: option A isopropanol, option B carbolic acid, option C chlorine, option D iodine. Our question, among this option, which one was the first widely or most commonly used antiseptic and disinfectant? And the correct answer is, it is carbolic acid. Option B is the correct answer. And the next question, endoscope is sterilized by options: option A Sidex, option B formaldehyde, option C chlorine, option D none of this. Endoscope is sterilized by using Sidex. Option A is the correct answer. Sidex is used for the sterilization of instrument, especially the instrument which cannot be autoclaved. Okay, that we can sterilize by using Sidex. For example, endoscope, sharp instruments, scissors and all sharp instrument, then rubber goods, all we can sterilize by using Sidex. Option A is the correct answer. The next question, best method of sterilization of sharp instrument. Options: option A hot air oven, option B radiation, option C autoclave, option D all of this. Question, which is the best method of sterilization of sharp instrument? In the previous question we discussed autoclave is not used for sterilizing sharp instrument. For quick sterilization we can use Sidex. And best method, here the question is best method of sterilization of sharp instrument is hot air oven. Option A is the correct answer. Move on to the next question. Which among the following are the essential factors of steam sterilization? Options: option A chemical and biological factors, option B time, temperature and pressure, option C use of adequate containers, option D all of this. Our question is, what are the essential factors of steam sterilization? It is time, temperature and pressure. Okay, for example autoclaving. Autoclaving need time, temperature and pressure. The temperature for autoclaving is 121 degrees Celsius and its pressure is 1.05 kilogram per centimeter square, and the time needed for autoclaving is 30 minutes, minimum 30 minutes. If the pressure is increased, then exposure time we can reduce in autoclave. And the next question, instrument used for tyndallization. Options: option A hot air oven, option B autoclave machine, option C Koch and Arnold steam sterilizer, option D flaming apparatus. Tyndallization is one of the steam sterilization method. It is also known as fractional sterilization, and the instrument used for this tyndallization is Koch and Arnold steam sterilizer. Okay, option C is the correct answer. Move on to the next question. Which among the following is a method of dry heat sterilization? Options: option A flaming, option B autoclave, option C ethylene oxide, option D all of this. Question, among this option, which is the method of dry heat sterilization? And the correct answer is option A flaming. Second option autoclaving. Autoclaving is a method of sterilization by steam under pressure. And option C ethylene oxide. Ethylene oxide is a type of gas sterilization. Move on to the next question. Autoclave machine can be kept at dash pressure when the temperature is set at 121 degrees Celsius. Options: option A 15 per square inch, option B 25 per square inch, option C 35 per square inch, option D 45 per square inch. Autoclave, pressure, temperature and timing, as we already discussed in the previous question. The temperature is 121 degrees Celsius And the total time for autoclaving is minimum 30 minutes, and the pressure is 1.05 kilogram per centimeter square or 15 lbs. And here our correct answer will come option A, 15 per square inch. Okay, the autoclave machine can be kept at 15 per square inch pressure when this temperature is set at 121 degrees Celsius. Move on to the next question. What is the meaning of hematosia? Options: ineffective straining of stool. Option B, lower GI tract occult bleeding. Option C, upper GI tract occult bleeding. And option D, none of this. Question: the word hematosia means it is lower GI tract occult bleeding. Option B is the correct answer. And the first option, ineffective straining of stool, that is known as tenesmus. Tenesmus, tenesmus. That means straining of defecation time, that is straining to pass motion or straining to urinate, that is known as tenesmus. And option C, upper GI tract bleeding, that is known as melena. Usually melena is blood in the stool, that is known as melena, but here upper GI tract occult bleeding, that is known as melena. Okay, our question, hematosia, that means lower GI tract occult bleeding. And the next question, site of IM injection is options. Option A, dorsal gluteal site. Option B, deltoid site. Option C, vastus lateralis. Option D, all of this. And the correct answer is all of this. Dorsogluteal site, ventrogluteal site, deltoid site, vastus lateralis, all are the site of IM injection. Option D is the correct answer. Move on to the next question. Tidal volume in an adult is options. Option A, 300 ml. Option B, 500 ml. Option C, 1000 ml. Option D, 700 ml. Normal tidal volume in adult, it is 500 ml. Option B is the correct answer. And the next question, in an adult, inspiratory reserve volume is about options. Option A, 3000 ml. Option B, 500 ml. Option C, 1000 ml. Option D, 1500 ml. Normal inspiratory reserve volume is about 3000 ml. Option A is the correct answer. And the normal expiratory reserve volume, ERV, expiratory reserve volume is 1000 ml. And vital capacity is 4500 ml. Total lung capacity is 6000 ml. This is important point. Vital capacity 4500 ml. Total lung capacity is 6000 ml. The next question. A nurse is caring for a client with a nasogastric tube that is attached to a low suction. The nurse monitors the client knowing that the client is at risk for which acid-base disorder? Options. Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. Here the question is, a nurse is caring for a client with NG tube or nasogastric tube. Okay, and this nasogastric tube is attached to low suction. So from the nose it is connected to the lower suction. So there will be gastric fluid loss through the NG tube to the suction. Loss of gastric fluid via NG suction. Okay, that leads to metabolic alkalosis. Because there is a loss of gastric fluid. Gastric fluid is acidic medium. This acidic fluid is lost through the NG tube. So there is a chance of metabolic alkalosis. Option B is the correct answer. And also in case of excessive vomiting, that can also lead to metabolic alkalosis. Move on to the next question. Same related question. A nurse is caring for a client with ileostomy. The nurse monitors the client knowing that the client is at risk for which acid-base disorder? Options. Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The previous question was related to nasogastric suctioning. Okay, here the question is related to ileostomy. Here now question, A nurse is caring for a client with ileostomy. Okay, and nurse monitor that which acid-base imbalance can occur for a client with ileostomy. As we know, our intestinal secretions are high in bicarbonate or base medium. Okay, this bicarbonate may lose through the enteric drainage tube. Enteric drainage tube means through ileostomy, that is inside the drainage tube, that can lead to metabolic acidosis. Suppose in case of diarrhea, mostly in case of diarrhea and all, we can see metabolic acidosis. On to the next question. A nurse is caring for a client with chronic obstructive pulmonary disease, that is COPD. The nurse monitors the client knowing that the client is at risk for which acid-base disorder? Options: Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. Here in our question, nurse is caring for a COPD patient, that is chronic obstructive pulmonary disease patient. Here in COPD cases, the patient may experience hypoventilation, decreased oxygen saturation in the body, which may lead to respiratory acidosis. Option C is the correct answer. Move on to the next question. Massaging medication over the skin is known as? Options: Option A, instillation. Option B, inaction. Option C, insertion. Option D, insufflation. Here the question: massaging medication, massaging or topical application, applying medicine over the skin, that is known as inaction. Option B is the correct answer. And option A, instillation. Instillation means putting a drug in liquid form into the body cavity is known as instillation. Okay, liquid form into the body cavity is known as instillation. For example, eye drops, ear drops, or instillation. By instillation we can do. And option C, insertion means introducing solid form of drug into the body cavity is known as insertion or inserting. For example, suppositories. And last option, insufflation. Insufflation means administration of drug in the form of powder or vapor or air into the body cavity is known as insufflation. Here our question: massaging medication over the skin, that is topical application of drug, is known as inaction. Option B. Today again we discussed important questions from fundamentals of nursing. Surely these questions will helpful for your studies. If it is useful for your studies, please subscribe my channel and share my videos to your friend circle.